Complete the sentences. Look at A, B, and C opposite to help you. Number one, someone who specializes in delivering babies is a midwife. Number two, someone who has qualified to assist nurses is a clinical support worker. Number three, someone who is not qualified but is able to assist nurses is a nursing auxiliary. Number four, a nurse who has qualified is a staff nurse. Number five, a nurse who specializes in health promotion is a health visitor. Number six, a nurse who looks after a ward is a charge nurse. Number seven, a nurse who works in the community is a district nurse. Number eight, someone who answers the ward telephone is a ward clerk. Make word combinations using a word or phrase from each box. Look at the opposite to help you. Carry out a procedure. Change a dressing. Check the temperature. Give an injection. Remove sutures. Complete the sentence with the correct grammatical form of perform. Number one, an isotope brain scan is painless and easy to perform. Number two, biopsy of the pancreas was performed last March. Number three, if the patient's conditions deteriorates, a laparotomy should be performed. Number four, if a diagnosis of meningitis is suspected, a lumbar puncture must be performed. Number five, last year we performed a randomized double-blind group of study. Complete the sentence with the correct grammatical form of carry out. Number one, I now intend to carry out a larger study. Number two, unfortunately, few properly controlled trials have been carried out so far. Number three, a number of studies have been carried out recently to look at this question. Number four, a right gemicolectomy was carried out and the patient made a full recovery. Number five, this procedure can be carried out in the emergency department. Make word combinations using a word from each box. Look at A, B, C, and the opposite to help you. Ambulance technician, artificial limb, club foot, contact lens, health professional, intraocular pressure, occupational therapist, social worker. Which allied health professionals could best help the following people? Look at A, B, C, and the opposite to help you. Number one, a young unmarried woman who has just had a baby, social worker. Number two, a woman who is having difficulty using her right arm following a fracture, physiotherapist. Number three, someone who needs glasses, optician. Number four, an elderly woman who has had a below-knee amputation, prosthetist, and occupational therapist. Number five, a man whose wife has Alzheimer's disease, social worker. Number six, a man with a fungal infection on his feet, podiatrist. Complete the text. Look A and C opposite to help you. A prosthetist works with patients of all ages as a member of a clinical team based at a large hospital. The patients may need a prosthetist as the result of an accident or amputation following a disease such as diabetes. Alternatively, they may have been born without a limb. Orthotists work alongside doctors, nurses, physiotherapists, and occupational therapists to give the people under their care the best possible rehabilitation. Their main aim is to enable the patient to lead a normal life at work and leisure. An orthotist often works in a clinic as a part of an outpatient service and also visits other centers to provide a service for people with special needs. They deal with people of all ages. For instance, children who have cerebral palsy may require splints to help them walk, and many older people need special shoes to correct deformity. If damage any part of the human skeleton may require some form of orthosis. The orthosis may be needed to reposition the body or to relieve